1 week later, we've just done the second treatment. I haven't really had a chance to catch up with you too much to see how it's all been feeling. So how have you been getting on?
Better.
Okay.
As in a lot less stiff, a bit more mobility.
Good.
Things like put my socks on.
Oh, you did tell me that, yeah. Good.
A bit more mobility to get down, which is quite nice actually. I'm still having a few issues on the right side.
Yeah, so how has that been over the last week? Is it happening just as much? More or less?
Less. The numbness is less.
Yeah.
I think I figured out one of the reasons, and it's work related.
Yeah, well, you pointed this out to me earlier, and we'll cut to that in a second. We'll show you your workstation.
Yeah.
And that's a very good observation, which is easy to overlook, and that might. So essentially, in a nutshell, we know you're getting the pins and needles, the sensation down into the little finger, which is the ulnar nerve, and there's different sites along the way where that can get aggravated. And I suspected it was coming from your neck, but it may be actually more work related. So that's been a little bit more better over the last week, but still there.
Yeah, it's still there. And I think the background stuff's still there, but the aggravation's a bit less.
And how's there just the general tension around your neck and shoulders at the moment?
Looser.
A little bit looser.
Good.
Yeah.
A bit more comfy when I'm driving, things like that.
Yeah. Okay. Good.
I still get myself doing this.
Is this at work or just day to day?
Just
day to day. How is it when you're working?
It's difficult. I think I'm concentrating. When I concentrate, I tend to just
fall back into old habits. Yeah. So this is the thing. It's you get these sort of 2-3 sessions in, and to start off just to get a bit of short-term progress, just to really make you feel a bit better. But then it's the long-term treatments is to try and really cement it. And hopefully we're getting to that point now where the bit of change we're starting to see now, we're really trying to cement in place.
We're more aware of things, which is
thinking about it.
Yeah, exactly, which is good.
But I've been saying for a long time we needed to get on top of your neck and shoulders.
Yes.
Finally getting to grips with it now, which is good.
So what it was, it's this corner here. So as I'm typing my clinical notes, it rests like this. I think that was triggering a lot of it. Yeah, so pinching right where that nerve runs, basically. Which is a bit more tricky just because of the way things are set up.
Yeah.
But it's something I'm more aware of now.
And it's something, not really we can do too much about other than just being aware of it.
Yeah.
And hopefully it's just probably a bit of trauma, blunt force compression right over the top of the nerve.
Yeah. On top of everything else.
So that was the third and final session we're going to be recording.
Yep.
How did you feel?
Worked out, but good.
A little bit knackered.
Yeah.
Funny that, isn't it? It can kind of shatter
But
you.
in a nice, relaxing way, actually.
So we worked a little bit around that forearm,
Yes.
which was tender, and that kind of corroborates what you were saying about potentially you're whacking it your office.
Feels better actually.
Good. We'll keep an eye out on that. Yeah. So that's the thing. Give it a few days, and if you're not aggravating it at work, fingers crossed, you might find that there's less pins and needles, less numbness through that. We also found, because every week we find something different. A lot of tension around your upper back, your sort of lower neck, upper back, that area there, which also coincides with this nerve as well. So again, not a coincidence. There's a lot of tension around your neck and shoulders, but it moved around quite nicely. Everything else around it, that one particular spot was tight, but the neck was okay. The upper back we loosened off quite nicely. And you're feeling okay at the moment?
Feeling good.
So we went over a few exercises as well, a bit of homework for you to begin on with.
That's important.
And this is again, we're transitioning now, we want more long-term change, not just make you feel a bit better for a few days. We want to fix the problem as best as we can, and it's a case of equipping you with a few tools that hopefully will mean, rather than you needing to come in and see someone like myself all the time, it might be once in a blue moon, because you'll have the stretches, you'll have exercises, and fingers crossed that will take care of most of it.
It's becoming more conscious for little bits. And
It's
on top of things.
Thinking about it a little bit more, isn't it? Yeah. Bro, any questions, or is that all okay?
That's it.
Excellent. Well, hope you feel a little bit better.
Thank you, Adam.
And we'll carry on sessions probably in the future. Brilliant. All right.
Thank you.
See you later.